Today's youth has changed, sir. Unlike when you were there, you wanted to have a process and then grow. Today's youth want to grow overnight. So, how you see this change in the society?
I think like in our field, your study is itself a long process. Like you study MBBS for 5.5 years, you go for an internship, and then you do your PG for 3 years. And if you want to further study DM MCS, another it's 3 years. So it's more than 12, 13 years. So I think what I feel is if you are in this field, by this time they already know that it's a long journey.
Welcome to HELLODOC. Today, the word is so much engraved into various types of diseases, problems, and everybody is running around doctors, medical colleges, nursing homes. But still, the people are not getting what they want. And that is why the medical fraternity has a very important role. So, ARYA Pharma Lab brings in this program what actually the doctors are going to offer to the common man. That is our motto with this program of HELLODOC. So, every week we will be coming out with one doctor who will be with whom we will be discussing on how he is going to serve the society. So today with me is Dr. Prashant Tripathi from Kathmandu, and we will have his insights on how he is guiding the youth, what inspiring things he is doing. But before that, I would like to know his journey, how the journey has started, and now how what challenges he see in the future.
Okay, thank you so much for the question. My journey basically started as a physician 10 years ago. It's a long journey basically. And then I finished my MBBS in 2006. After that, I did house job for 2 years, and then I went for my PG. So, working as an internist or internal medicine specialist, it's already been 10 years. And my first place where I worked as an internist is Grande International Hospital. So it's been quite a roller coaster ride, I should say. Like I still remember those days, like when I was young, full of energy, uh, wanting to do something in this field. And I feel I still have that energy and passion for what I love doing. Like medicine is the field that I always loved. I always wanted to become a doctor. So it's been a great journey. Uh, I've been able to help quite a few patients, which I'm really proud of. And most importantly, my parents are really proud of. Like it was my father's dream uh, to for me to become a doctor. So, and I'm in that way also. I'm really, really happy that I was able to fulfill his dream, his wish. Uh, since then, like it's been 10 years. I already told you. So it's been a nice journey. Sometimes, yes, it's really frustrating. Like,
So, sir, like you said, your journey, your your father dreamt of you being a doctor.
yeah,
You also want to become a doctor, and finally the dream has come true. But day to day, you are facing a lot of challenges also, and day to day you are facing when you are passionate enough, you face those challenges in with a good spirit, sir.
yeah, exactly. Like, uh, obviously, there are lots of challenges now, right now. And if we look at the situation in Nepal, and I think it's also the same with India, like we hear so many things. Uh, like it's for doctors, it's been really difficult to work here actually. Things like wages and then those vandalism, all those things. Sometimes they really let us down. Yeah, yeah, we really get pissed off. But then at the end of the day, when that uh, woman or man or old lady who comes crying to you, and when you discharge him or her, there's a smile of on their face. I think that's the priceless.
That is the best.
That's what we live for. That's what we thrive for. That's what I personally live for. That thing is, there's no comparison.
Priceless. Yeah, definitely, sir. So, sir, like the theme of the event is also about the inspiring the youth. So, what is your advice to the youth today?
First thing I'd like to tell the youth is, uh, don't get disheartened. It's a tough job. It's really, really challenging job. You'll face many difficulties in life, but then at the end of the day, if you remember to do good for your patients, the rewards will come automatically. Like as I already told you, there are so many issues like lack of job, your salary, everything. But then what I have always felt is, being a doctor, all those things are secondary. The first thing is the care to your patient, your compassion. And then if you are on the track, and I also tell my juniors, eh, don't rush in everything, because it's a kind of field where you go day by day, and it's a very slow process. The place I am here right now, it took me 10 years to come here, and 10 years is a long journey. So, like, it's not like maybe other professions where overnight you can become a superstar. It's not. Eh, In medicine, that never happens. That's why I always tell my juniors, you always keep thriving, you always put in your best job, you always do your hard work. That day will definitely come.
But, sir, they, like you said, that you tell to your current youth that they should not go for quick solutions, quick. But today's youth has changed, sir. Unlike when you were there, you wanted to have a process and then grow. Yeah. Today's youth want to grow overnight. So, how you see this change in the society?
I think, like, in our field, it's a, like, your study is itself a long process. Like, you study MBBS for 5.5 years, you go for an internship, and then you do your PG for 3 years. And if you want to further study DM MCS, another it's 3 years. So it's more than 12, 13 years. So I think what I feel is, if you are in this field, by this time they already know that it's a long journey. So most of the people, I think they have a little bit in their mind, like, it's a long journey, so I need to be patient. But yeah, you rightly said, like, maybe because of the youth, uh, because of their energy, people tend to get very impassionate. They want the success overnight. They want it quickly. But again, I want to say, in the field of medicine, that never happens. However talented you are, how many, however many gold medals you have, you still need to put in your effort. You still need to convince your patient. You There is no shortcut to success in our medicine, in our field. So that's what I really emphasize on the youth, and I always tell them to improve yourself. Updating is very important in our field. The treatment that was done 5 years back, some treatments they become absolute today. You need to keep learning. So these are the things I think the new generation, the youths, they need to put in their mind.
Sir, very you as you said that keep on learning is very much important, and it takes time to keep learning. So that is a very valuable suggestion to all the youth. I think the youth, once they will listen to you, they will follow your advice, and will definitely grow in your life like you have gone through, sir. Thank you, sir. Thanks for your insights in this podcast, sir. Thank you.
Thank you so much. Thank you for giving me a chance.
Thank you,
I
sir.
hope my juniors, the youth, the youngsters, they hear this and they follow it.
Thank you, sir.